Hey everybody, welcome back to the channel. David here, former paramedic and owner of Heaven Can Wait. Happy Sunday Fun Day. Now, medical topic today, heart attack. We're going to talk about the signs and symptoms of a suspected heart attack and how to treat it with respect to first aid procedures, okay? Heart disease is the second leading cause of death in Canada. This is very important video to watch, and you may want to watch it multiple times and share this as well, and all the information will be in the description section. Okay, here's a quick little topic outline. We're going to talk about some anatomy of a heart attack. We're going to talk about risk factors. We're going to talk about signs and symptoms in both men and women because there are some variations, and we'll talk about some first aid, okay? Let's proceed with this journey. Let's talk about some anatomy. These are very basic COVID-19 tools we're using because we've been in isolation. Here is your blood vessel, the artery that's inside the heart, okay? Feeding blood and oxygen. It's completely clear. Blood can get right through there and it can feed the heart muscle. If it gets clogged with plaque or other cellular debris, such as this, blood cannot travel through. So all the cells on the other side of the heart muscle, because it's blocked, get starved of oxygen. They will eventually die. That is a medical emergency. That is a heart attack. Okay, let's talk about another topic now. Risk factors. Obesity, high blood pressure, even genetics. If you have pre-existing medical conditions, drinking, drugging, lack of exercise, poor diet, there are many more, but all those will increase your risk of heart attack and stroke. Okay. Next topic, again, clean and to the point. Signs and symptoms. These are generic signs and symptoms I'm going to list right now for you. Clutching the chest is a big one. Chest pains, pressure, tightness, chest heaviness, chest constriction. Feels like an elephant sitting on your chest. Dizziness, short of breath is common. Pale and sweaty is very common. Other big ones, nausea, vomiting, and heartburn, acid reflux, indigestion. Those are big. Left and or right pain, a sense of impending doom, these are all very common. Now, somebody doesn't need to have all these signs and symptoms to be having a heart attack. It could simply be one of them. Now, for females, jaw pain, neck pain, back pain, shoulder pain, tooth pain, pain between their shoulder blades, these are common. In women as well, shortness of breath, flu-like symptoms 7 to 10 days prior to having a heart attack are common. Fatigue, weakness as well. Stomach upset, nausea, vomiting, and if I didn't mention, I think I did, the short of breath, okay? If you think you're having a heart attack or if somebody else is having a heart attack, here's what you're going to do immediately. You're going to dial 911. You're going to put the phone on speaker. You're going to get the address of where you are. You're going to unlock the front door. You're going to discontinue activity. You don't want to be running around when you're having a suspected heart attack. Now, do not drive yourself to the hospital. Not every hospital can deal with specific type of heart attacks. The paramedics need to take you there, and very bad things can happen if you drive yourself to the hospital. I'll just leave it at that, okay? Now, there is a very powerful medication called aspirin, ASA, acetylsalicylic acid. I'd like you to research this. If your doctor says it's safe for you to take aspirin and you don't have an allergy to aspirin, the dose, the blood thinning dose for somebody having a suspected heart attack is 281 milligram aspirin. You chew it in your mouth into a fine paste and swallow. Mark the time of when you've taken it. Do not take it with water. If all you have is a 325 milligram aspirin, you chew that into paste and swallow it as well, okay? So you ask your doctor. I'm not giving medical advice. You need to ask your doctor if you are safe to be able to take aspirin, no allergies, and no other indications or no other contraindications to take an aspirin, okay? So make sure. And if you're okay to take it, a lot of people carry it with them in their wallet, in their purse, at the office. It is a life-saving medication. The most common sign or symptom of somebody having a heart attack is denial. If you think you're having a heart attack, you need to get to the hospital immediately with paramedics. If you think somebody else is having a suspected heart attack, they will most likely deny it, override them, call the ambulance. Nothing to eat or drink. That is what you need to do. Recognition, signs and symptoms, ambulance, consider aspirin. They go to the hospital with paramedics. That's it. If you have any other questions, please feel free to write into the comments section. We look forward to speaking with you soon with some other medical emergency topics. Please subscribe And I'm going to put 2 links in the video in the description section that have real heart attacks so you can actually see what they look like. Stay safe, everybody. Be well, be healthy, and we'll speak to you soon.